Ontario parents are being forced to disclose their children's private medical records in order to keep them in school, with health officials issuing suspension orders for non-compliance. This data is then not only tracked by local health units, but also shared in centralized databases like Panorama. And parents are being told that they have no choice. They have to comply or else. So is this really about public health, or is it a clear overreach of one ministry into another? In this report, I reached out to Toronto Public Health for answers, so let's dig in. Over the past week, I have been reporting on Ontario's mandatory disclosure of children's medical records by public health, where parents are being threatened with suspension orders for their children if they don't comply, even though suspension orders must be regulated and adhered to under the Education Act. However, medical officers of health are now directly suspending under the Immunization of School Pupils Act, called the ISPA, stating that children must be vaccinated or their parents must submit a legally binding exemption affidavit, which then tracks and shares this data in centralized databases like the federal $147 million public health surveillance system. As I've detailed in previous reports at stopvaccinecoercion.com, these systems are heavily prone to hacks, leaks, and breaches. Adding to this overreach, health units are even going directly into schools to vaccinate children in an attempt to make them compliant with the ISPA and avoid senseless and prolonged isolation from their publicly funded education under the guise of suspension orders. Concerned about privacy and consent, I reached out to Toronto Public Health about their recent high school vaccination clinic. Here is what they had to say. Firstly, I asked what steps Toronto Public Health, or TPH, takes to ensure privacy protection when students are removed from their learning environment in front of peers, classmates, instructors, teachers to partake in this catch-up clinic. TPH confirms that they work closely with students, parents, and guardians, schools, and school staff, and the 4 Toronto District school boards to help protect the health, safety, and well-being of students and the broader school community. Throughout the school year, Toronto Public Health offers routine vaccinations to children and youth attending school. TPH hosts vaccine clinics in schools on a routine basis and as required in the Ontario Public Health Standards. They confirm that students in grades 7 and 8 are routinely offered vaccines in school: meningococcal vaccine, which prevents meningitis, human papillomavirus vaccine, which prevents cancer, and hepatitis B vaccine, which prevents liver disease and cancer. Keep these words in mind because I'm going to come back to them at the end of this report, but for now, they go on to source the Immunization of School Pupils Act, the ISPA, which requires that students be vaccinated against 9 vaccine-preventable diseases or have a valid exemption to avoid suspension. These diseases are diphtheria, tetanus, polio, measles, mumps, rubella, meningococcal disease, pertussis, whooping cough, and varicella, which is chickenpox if born in 2010 or later. As part of ISPA, students who are not up to date with their vaccinations or exemption can be suspended from school. TPH provides some clinics in high schools to get students caught up to prevent this suspension. They say that information and consent packages are sent home to families through schools, and make another broad claim that TPH ensures the privacy of students' health information is maintained and protected, even though students are being literally called down to the vaccination clinic in front of their teachers, peers, and school community, making no mention of how exactly that ensures their privacy is protected. Next, I ask which is the superior legislation governing medical records, the Immunization of School Pupils Act or the Personal Health Information Protection Act. TPH responds that they follow many legislative requirements in relation to vaccination, including the OPHS, ISPA, PIPA, the Municipal Freedom of Information and Protection of Privacy Act, and the Healthcare Consent Act. So this is basically a non-answer. Third, I ask which legislation grants public health the authority to come into schools and vaccinate children. Please specify the section. And they say refer to A1. So I think this is where Toronto Public Health refers to the protocol from 2018 titled Immunization for Children in Schools and Licensed Childcare Settings. Interestingly, this protocol outlines the information that may be collected, including student name, address, phone number, date of birth, school, class, and grade, their health number, parents' contact information, records of immunization, or statement of medical exemption or religious belief form. That's interesting verbiage because they don't refer to this as a legally binding affidavit, despite the fact that the form given to parents states that it is such. Now, this protocol also outlines the mechanisms for the collection and capture of demographic and immunization information, which states that they will collect and capture all demographic and immunization information in the Centralized Provincial Digital Health Immunization Repository, referred to as Panorama. The Board of Health shall follow privacy requirements as specified in the Personal Health Information Protection Act, and all other privacy requirements as applicable when using mechanisms to collect, use, and disclose demographic and immunization data and inputting this data into Panorama. Remember here that PIPA, the Personal Health Information Protection Act, has a clear element of consent section, which states if the act requires the consent of an individual for the collection, use, or disclosure of personal health information by a health information custodian, the consent must not be obtained through deception or coercion. And a principal, secretary, teachers, or other school staff are not health information custodians, so they should not know a child's private medical information without explicit consent or voluntary disclosure by parents, which again cannot be obtained through deception or coercion, which threatening healthy, otherwise perfect students with sweeping months-long suspension orders could easily be seen as coercive. Now back to the protocol, it also states that the Board of Health shall accept different methods for the collection of demographic and immunization information, including, but not limited to, online, verbal, and written/printed immunization records. So why the heavy-handed measures to enforce the physical submission of legally binding exemption affidavits? This protocol has clearly listed options. Okay, so back to Toronto Public Health's response. Question 4. Why was the February 11th, and I made a mistake here, it was actually conducted on February 7th, catch-up clinic not listed on the City of Toronto's school immunization program website, and how many others are not listed? Toronto Public Health has a rambling response here, but basically they're hosting grade 7 and 8 students next month or in the spring, and they'll post the clinic dates then. They're offering some clinics to high school students to get them caught up to prevent, again, this school suspension. And that high school catch-up clinics in schools during class hours are only to eligible students in that school, and that the students and families have been notified directly through the school, so they don't publicly post when they're going into high schools. Question 5, how are children monitored after receiving their vaccines, for how long and by who? This response shocked me. A public health nurse will observe students for 15 minutes after vaccination for any reactions. Students can be observed for longer if needed. Reactions following vaccination are usually mild. Common side effects include pain and redness where the vaccine was given, headache, fever, dizziness, nausea, or feeling faint shortly after receiving the vaccine. In rare cases, serious allergic reactions such as trouble breathing, rash, swelling in the throat and face may occur. Allergic reactions usually present in the first 15 minutes and can be treated. Question 6, how are parents informed about monitoring or reporting adverse events, and how does TPH follow up with vaccinated children to ensure they're not experiencing adverse events? Question 6, and this one actually is the one that shocked me. An adverse event following immunization, AEFI, is any event or reaction that occurs after receiving a vaccine. A causal relationship does not need to be proven before reporting. Of particular interest are those of a serious nature requiring urgent medical attention or are unusual or unexpected events. Again, they're doing this at school, sometimes without parents knowing because they didn't check their email the night before. In Ontario, under the Health Protection and Promotion Act, health professionals who administer vaccines are required to report AEFIs to their local public health unit. Public health units investigate the AEFI and they provide support and information to immunizers, individuals, and their families. All AEFIs investigated by TPH are forwarded to Public Health Ontario, then to the Public Health Agency of Ontario. So you can see that this is a multi-level bureaucracy involved in these reports. Adverse events are also compared internationally. Companies that produce vaccines do not help with investigations of AEFIs, but they are aware of reports for the safety of their products. Should an individual experience an adverse event following immunization, they're advised to ask the healthcare professional who administered the vaccine to complete an AEFI form. So this is basically another non-answer as to how they ensure parents know how to report adverse events, and clearly public health isn't following up to inquire. Question 7, why did the February 11th, again, it was actually February 7th, catch-up day target grade 11 students only? This is another long-winded response, but basically TPH is saying they adhere to vaccination coverage rates at age 7 and 17 because those are common metrics used by the World Health Organization to determine if countries are maintaining high vaccination rates in childhood, and is prioritized as part of TPH's school vaccination program. They confirmed that ISPA compliance lagged throughout the COVID pandemic and suspensions were not issued, but they're ramping it up again, beginning in the 2023-2024 school year and continuing into 2024-2025. TPH has assessed the records for students attending schools born in 2016. This was to get students who are 7 and 8 years of age caught up with childhood and kindergarten booster vaccinations, including a second MMR vaccine. Almost 23,000 students born in 2016 were assessed by TPH. Initially, the compliance rate with the ISPA was only 29%, and after they assessed and began that suspension process, the compliance increased to 98%. They also post all the vaccination rates and coverage by school on their website. That's interesting. Now, fast track to now during the 2024-2025 school year, TPH is assessing the vaccination records for grade 11 students born in 2008 because they were impacted by the COVID-19 pandemic and missed those school-based vaccinations when they were in grade 7. They sent out threat letters to their parents and the schools alerting them to get caught up and began sending individual letters in January. Students who are not up to date can be suspended in the spring of this year. So that's coming up. Finally, Toronto Public Health confirms that Ontario has the Healthcare Consent Act, in which there is no minimum age in Ontario for informed consent, but that they only vaccinate with informed consent. Now, at TPH clinics, parental and legal guardian consent is required for students under the age of 14. If a student 14 years or older is capable, they can provide their own consent. And again, that information and consent package is apparently sent to students and families through the school. But is Toronto Public Health really giving informed consent when they make claims in their opening statement that vaccines like the meningococcal, HPV, and hepatitis B prevent serious diseases and cancer? For example, Pfizer's meningococcal vaccine clearly states that it's only indicated for invasive meningococcal diseases caused by the Neisseria meningitis groups A, C, W, 1, 35, and Y. These are 4 strains out of dozens, if not hundreds, of different strains of viruses, bacteria, fungi, parasites, and chemical causes of meningitis. Their overly broad and misleading claims that these vaccines prevent cancers and liver disease are incomplete, giving people a false sense of security about their protection from a wider range of infections and illnesses, further showing that public health wants all of your data transparently, but won't exactly be transparent back. The fact remains that public health vaccination efforts in schools, alongside the coerced disclosure of private medical information for storage in vulnerable databases, exemplifies a troubling overreach into another ministry's jurisdiction. This disregard for privacy and consent ultimately exploits children as leverage for data collection and solicitation. If your child has been the target of such overreach, please contact me if you're willing to share your story, even if anonymously, to protect your privacy, at tamara@rebelnews.com. For Rebel News, I'm Tamara Ugolini. To get involved and stay up to date on reports just like this, please go to stopvaccinecoercion.com and sign the petition. That's stopvaccinecoercion.com.